Happy Friday, everyone. Today we're talking about lower surgery. I thought I'd break it down to two little sections. The first one just kind of talking about the two basic types of lower surgery, and then the second part talking about my personal feelings on lower surgery. So first of all, can we not call it bottom surgery? It makes me think, every time I hear that, it makes me think you're getting surgery on your ass. You don't need to see a proctologist for this. Let's not get into that. Either way, lower surgery, I kind of like using that. I hear a lot of people say they don't like the term bottom surgery. Actually, call it whatever you want, but I prefer to say lower surgery. I also usually say chest surgery instead of top surgery, so I get why people say top and bottom, but whatever. Top surgery makes more sense to me than bottom surgery. Whatever, semantics, right? Okay. So lower surgery, you have two basic kinds. The metoidioplasty, shortened to meta, people call it meta, which is basically when the doctor takes the growth you've gotten on T, you know, the little dick you have, and releases the suspensory ligament. It allows the penis to hang more freely, for the erection to be a little bit bigger. You can do what is just called a clitoral release and just do that, and that's the end of it. That's about a $3,000 to $8,000 surgery. Or you could have, they also call that a simple meta, so it's called a clitoral release or simple meta. Then metoidioplasty often refers to kind of like the works where they do a urethral hookup, so you can urinate standing up. They do a scrotoplasty, so you get balls and you can actually pick the implant size, small, medium, large. I went with my best friend for his phalloplasty with Dr. Crane, and I was actually like juggling the ball implants. It was kind of funny. But either way, yes, you can pick your size, just like the breast implants. And so it will often include a vaginectomy. You know, they close up the vagina. Some surgeons leave an opening to allow fluids to seep out and to escape. Other surgeons have different techniques. Dr. Crane doesn't do that. You really have to research your lower surgery well, because you can also get a combination of things or not one or the other. You know, some people want to get a release and a scrotoplasty, but not the urethral hookup. So lower surgery is really kind of a grab bag, and you can kind of pick and choose what you want. It's very specified to you. Another thing I want to say that I hear a lot is that lower surgery is not up to where we want it and the standards aren't there, and I get what you're saying. I've said something similar in my videos, but I realize that discredits people and kind of devalues and speaks to an experience that I, or someone that hasn't had surgery yet, can't really say. People that have had it, you know, a lot of them are very happy with it, and they consider them functioning and whatnot, and surgery really has come a long way. This book, Hung Jury, Testimonies of Lower Surgery by Transsexual Men, that was the intro about this book, saying about how really there's this kind of bias that, oh, technology is not where it needs to be or where I'm comfortable with, and it is very cost prohibitive. These surgeries are so prohibitively expensive. But the intro said that some of these surgeries actually are to the point where they pass as male, and I hate to use that term, but basically the opening letter by this guy, his partner, his wife, who had been with cisgender men, said she had sat in on a panel of, you know, transsexual surgeries, and she said she honestly couldn't tell with some of them. And it doesn't matter. They don't have to be cis-normative. And I think the point is we be happy with our genitals. So, little political rant. I just don't want to invalidate people's feelings, because no, it's not to the point where you can just get an erection by yourself, you know, like with a phallo. But it's also extremely important for some people, absolutely needed for them, and they do feel complete, and it is good enough for them. And I don't want to get into semantics with the passing and stuff, but yeah, I just don't want to invalidate anyone's feelings. So with these surgeries, sometimes they do feel the metoidioplasty is enough or the phallo is enough, and I just don't want anyone to feel that the choices they've made are wrong or just feel judged for it. So either way, back to metoidioplasty. And lower surgery in general is kind of a grab bag. You pick and choose what you want. Lots of different surgeons. You really got to look into it. So with metoidioplasty, you use your own growth. You can pee standing up if you want. It's often not big enough to penetrate, but many people are happy with it. And it's what most people tend to lean towards, I think, because it's less invasive. They're both extremely taxing surgeries on the body. But meta is not as taxing as the phallo. People also pick it not only because of the financial reasons that it's so much less expensive than the phallo, but still extremely expensive. I mean, anywhere from $26,000 to $57,000, depending on what you get. So with meta, the draw is, you know, you use your own penis growth, and then so you can feel it, and also you get your own erections. So that is something that's important to me, and peeing standing up is very important to me, so I would have a urethral lengthening no matter which option I chose, fallow or meta. So that's the basics of the meta. The next type of surgery is the phalloplasty, or the fallow. This uses a skin graft. They either take, they call the radial forearm, or actually I forget the abbreviation of this, or the thigh, or the back, actually up here. The arm is going to give you the most sensation. A lot of people choose their thigh to cover up, you know, so their scars are covered up, because this is quite an intense scar, depending on how big you choose the phallus to be. It's quite an intense scar. And then the back is going to be the least sensitive, but also the least noticeable scarring. So what happens with a fallow is it's a skin graft. Way back in the day, they used to do kind of like abdominal suitcase phalloplasties out of the fat here, and just kind of hung. You had no sensation. These days, surgeons like Dr. Crane are really taking it to the next level, where you feel the nerves and you can actually feel the penis, and it's awesome. The only drawback to the phalloplasty is you don't get your own erections. You either have to get an implant, like a Gore-Tex implant, and those have a life of 10 years. Dr. Crane said he hadn't seen any last beyond 4 to 6 though, so those are going to bust. Those are going to eventually need to be replaced. Dr. Crane actually said most people for an erectile implant, what they end up getting, I forget the official name, but he calls it a Gumby penis, where it's a rod. And so the penis is always somewhat hard in a way, but you know, you bend it down, you can bend it any which way that you want for sex. And he says most guys get that. In July of 2013, I spent a month in San Francisco with my best friend who had gotten fallow as his caretaker, and I got to spend a lot of time talking to Dr. Crane and seeing him through the process. And that really changed how I felt a lot about my own thoughts on lower surgery. So, with the fallow, you take the skin graft, they shape the penis. It often is a surgery that has to occur in several stages, such as you get the phallus in the first one, and then they do the urethral lengthening to allow you to pee standing up, and then the glandsplasty where they make the head of the penis. It's quite an intense surgery. You immediately go to ICU. It's very taxing on the body, but a lot of people are very happy with fallow, and seeing my friend's fallow really made me want to do it. But then seeing how sick he got, and just how tough it's been, and how many surgeries and revisions he's had to have, I don't know if I could do that. Like, I don't have that kind of medical tolerance that he has, and he's much stronger than me in certain ways and physical ways, and I just don't know if I could do that. But he's very happy with his results, which is great, because when I saw them, I immediately was like, whoa, maybe I'll get the fallow instead of meta. Because Dr. Crane is an excellent surgeon, and anyone I've talked to that has had surgery with him, whether it be meta, fallow, or even their chest surgery, are extremely happy. He's such a personable guy. He's great. He's in San Francisco now, but he's going to be moving to Austin, Texas. But either way, the fallow, they take a skin graft. My friend had it done from his thigh, and they have to take another bit of skin to put over the graft, and it's quite an intense healing process too. But if I did it, I don't think I'd use my arm. I think my thigh skin would be thin and sensitive enough for sensitivity. But either way, I'm still on the fence. I've always been on the fence. The draw to the meta is, it's me, I get my own erections, I feel it. But Dr. Crane said if your goal is to penetrate, he said, I gotta be real with you, you're not gonna penetrate with a meta. I mean, you might, get a little bit, but not in the way that you would with a fallow. The fallow, the drawback is you don't get your own erections. That's something that I kind of want to just happen, You get horny or whatever, and you get hard. That's very important to me, and having that natural response right now with my own dick is extremely important to, like, how I feel about my body and my masculinity and whatnot, how my body expresses itself. So that's what makes me lean towards meta, but then at the same time I want an adult male-sized dick. So that's hard, and it's not just the dick size or the erection, it's a lot. And so it's not just being this, like, phallocentric. There's just a lot to it, and I actually have really severe lower dysphoria, so I know that lower surgery is in the cards for me, either the meta or fallow. What's actually cool is you can get a meta and then a fallow, and Dr. Crane actually prefers to build the meta over the fallow because I guess it's easier to integrate the nerves and stuff. So I've known people that got a meta and then a fallow, so that might be something I do. Not that I have all this money to throw around, but I'm looking at ways to try to get it covered. Kaiser covers lower surgery, so I'm looking to get a job that has Kaiser insurance, so that's something that I've been just I've had on my palate for a while. So I know I want it and I know I need it in order to feel just whole. Some people don't, and that's fine, and that's totally valid. I completely feel like a man. Sometimes when I say this, people are like, oh, you don't feel like a male. I'm like, no, I completely feel like a male. I will just feel finally at peace and more complete, and that's important to me. And I can't bring politics into how I navigate this dysphoria sometimes. It's so tough. So yeah, those are the two kinds. That's how I feel about it. Also, of course, there's the hysterectomy. That is needed to get any kind of lower surgery. Some people don't consider it lower surgery, but it's below the belt, so I thought I'd mention it. I just had mine done on Monday. I'm actually filming this on Thursday, so I'm 3 days post-op. Feeling great. I had it done laparoscopically in a minimal amount of pain, but it's to be expected with a major surgery. They go in and drill all your organs up. I have 4 incisions. I'll show them to you. The big one is around my belly button. So, let's see, there's this one, and then the major one about my belly button. I'm still bloated, because they fill you up with gas, so without giving you the whole show, there's that incision and that incision. Unless this glue little bit was coming off, I would not even feel these. They don't hurt at all. This is very tender. Try not to let anything rub against it. My surgeon placed these 2 scars purposely below my underwear line, just to not out me. He was really thoughtful with things like the scar placement and stuff. So when I go surfing and skimboarding, I can wear the board shorts and they don't show. And I was thinking, the scars, my double incision scars, are kind of more noticeable than the hysterectomy. I think they would out me before these scars did, but he was very conscious of that, and I appreciate that. So I feel a lot better after having all those organs out that should not have been there, no longer having that testosterone estrogen war. And yeah, it's great. I feel really good. I'm glad I got it done. I needed to have it done. It was medically necessary. I had precancerous endometrial lining, so that needed to go. Yeah, I feel great. If anybody has any questions about the histo, I'd be happy to answer them, or about lower surgery, I can answer them to the best of my knowledge. Also, you can check out my channel. I've been documenting my histo experience and filming a kind of documentary style short or vlog type thing, and I'm going to edit it all together and eventually get it on there. So yeah, thanks for watching. I'm sorry I missed the past 2 weeks. I'm having crazy technical issues with my camera and then my editing program, so I'm here this week. I hope you all are well. Alright, take care. Have a great weekend.